My name's Trey Stewart. I live in northern Maine. I represent Senate District number 2, which is Aroostook and Penobscot counties in the Maine Senate. I'm the youngest member of the Senate. I serve as the ranking member of both the Energy, Utilities, and Technology Committee, as well as the Health Coverage, Insurance, and Financial Services Committee. Where I live up in Aroostook County, which is the northernmost county in our state, the northernmost county in the lower 48, it's hard for my constituents to be able to access the quality of health care that they need in some instances. When the government tries to fit everybody into the same box and subscribe them to the same sort of access to care, outcomes go down and patients suffer at the end of the day. If you live in Aroostook County, I'm about 5 hours north of Portland. I'm about 7.5 hours north of Boston. So for me, what that means, or any of my constituents that live around me that I represent, they have to take time off of work, possibly hire folks or line up folks to take care of their children or their dependents and their other responsibilities back home, because they're probably going to be gone for a couple of days for, again, that 30-minute checkup. If you can eliminate those costs, you could do two things. One, lower the cost of the patient, but two, also increase health outcomes. And it's as simple as, in this case, getting government out of the way to do just that. A constituent of mine lives in Presque Isle. I'll call him John. He called me up one day, and his wife had a really serious mental illness, and the folks in Maine couldn't figure out what was wrong with her. They found a specialist, but they were in Baltimore. So for my constituent who lives in Presque Isle, and Baltimore, I've driven from Presque Isle to DC before, that's about probably 15, 16 hours on the road. Multiple days of travel each way, multiple days in a hotel room. They have kids back home. They simply couldn't afford it. But they found the right doctor. They found somebody who could help resolve the problems that his wife was having. But the government was in the way. Eventually, I was able to figure out who the right contact was within state government and put my constituent in touch with them. And at around the same time, the governor had passed an executive order that allowed for an expansion of telemedicine. And so we were able to apply that to my constituent's case and his wife and get her the medical treatment that she needed in order to resolve and get her condition under control. Fortunately, we were able to enshrine a lot of those changes into state law through the work of my committee over the past year. Learn from the lessons of COVID that really spurred on and forced that conversation that should have happened a long time ago, if we're being honest with ourselves.